Hi, I'm Karen Marchand, genetic counselor at Beth Israel Deaconess Medical Center.
And I'm Karen O'Brien, maternal fetal medicine physician at Beth Israel. First, congratulations on your pregnancy. While most babies are born healthy, approximately 3 to 5% will be affected with birth defects or genetic conditions. In all pregnancies, women are offered testing to help determine which pregnancies are at higher risk for these types of problems. Decisions about testing in pregnancy are personal. Some women choose not to have any testing done. Others find the information from testing to be helpful. Our goal in this video is to provide some information on the tests available to help you decide what makes sense for you and your family. It's important to remember, though, that no test can look for all problems a baby can be born with, and that a small chance for a problem remains no matter how much testing is done in a pregnancy.
Let's start by reviewing some of the basics of genetics. Most of the cells in the human body have a nucleus, where genetic material, also called DNA, is stored in chromosomes. Each chromosome contains many genes, which are the individual instructions that tell our bodies how to grow and develop, and are responsible for all of our inherited traits, such as height or eye color. Typically, each cell contains a total of 46 chromosomes, arranged in 23 pairs. Half of the chromosomes, one from each pair, are inherited from your mother, and the other half are inherited from your father. The first 22 pairs are numbered from 1 through 22, and the 23rd pair are the X and Y chromosomes, which determine whether someone is male or female. Typically, females have 2 X chromosomes, and males have an X and a Y chromosome.
When a person's body makes eggs or sperm, their chromosomes need to be sorted so that each egg or sperm will receive 1 chromosome from each of the person's pairs, for a total of 23 chromosomes in each egg and sperm. An abnormality can occur at the time that a person's body creates the egg or sperm that results in an extra or missing chromosome in the baby. A missing chromosome is called a monosomy, and an extra chromosome is called a trisomy. Trisomies and monosomies are labeled by the specific chromosome that has an extra or missing copy. For example, the presence of an extra chromosome 21, which is what causes an individual to have Down syndrome, is called trisomy 21. When there's a trisomy or a monosomy, the extra or missing genes can change the way an individual develops and can cause various health problems. Most trisomies and monosomies lead to miscarriage, and in fact, this is the most common reason why miscarriages occur. The most common types of trisomies seen in babies that survive past the first trimester of pregnancy involve chromosomes 21, 18, and 13.
Down syndrome is caused by trisomy 21 and is usually noticed at birth due to the presence of certain physical differences: low muscle tone, a single crease across the palm of the hand, a slightly flattened face, and an upward slant to the eyes. People who have Down syndrome have mild to moderate intellectual disability. The degree of intellectual disability varies from person to person and cannot be predicted during the pregnancy. Most children with Down syndrome are able to learn and go to school and actively participate in their family, but as adults will usually need some level of supervision and may not be able to live on their own. Some health problems are more common in people who have Down syndrome, but are usually treatable. The average lifespan for a person who has Down syndrome is 60 years.
Trisomy 18 is also called Edwards syndrome, and trisomy 13 is called Patau syndrome. These conditions are more severe than Down syndrome. They are associated with medical problems that often lead to death during infancy. 50% of babies who are carried to term will be stillborn. Of those babies who are born alive, fewer than 10% will live to their first birthday. Children who have trisomy 13 and trisomy 18 and do live past 1 year of age will have severe intellectual disability and usually other major health problems as well.
The chromosome conditions we have been discussing happen just by chance and are usually not inherited in families. There is nothing a person can do to cause one of these conditions to happen or to prevent one from happening. The chance for a trisomy to occur in a pregnancy increases with each year of age and can be estimated for any woman based on how old she will be when the baby is born. This is referred to as the age-related chance. For example, a 25-year-old woman has a less than 1 in 1,000 chance to have a baby with Down syndrome. A 35-year-old woman has a 1 in 350 chance to have a baby with Down syndrome. A 40-year-old woman has a 1 in 80 chance to have a baby with Down syndrome. So even though older women have a higher chance for these abnormalities can occur for women of all ages.
Many parents feel that they would want to know during the pregnancy if their baby had one of these conditions. If such a condition is detected during pregnancy, we carefully discuss all management options. Some parents like to have the information for planning purposes so that they can have special monitoring in the pregnancy and so they can prepare and get ready for bringing their baby home and raising a child with special needs. Other parents may make an adoption plan for their baby or choose to end the pregnancy if they receive a prenatal diagnosis of a genetic condition. Some parents may feel that they would rather not find out about the diagnosis until after their baby is born and decide not to have any testing aside from routine ultrasound.
Let's go over the difference between diagnostic and screening tests. Diagnostic tests will tell you most accurately about whether or not there is a chromosomal abnormality like a trisomy or a monosomy with detection rates of 99.9%. These tests require a sample of cells be obtained from the pregnancy, which poses a small chance for miscarriage. Screening tests can estimate the chance for a baby to be affected with the most common chromosome abnormalities. They cannot tell for sure, but are not invasive and pose no risk to the pregnancy.
Chorionic villus sampling, or CVS, and amniocentesis are the two diagnostic tests available during pregnancy. CVS is done at 10 to 13 weeks of pregnancy. Depending on where the placenta is, a thin tube or a needle is used to sample a tiny piece of placenta. Amniocentesis is done later in pregnancy, usually after about 15 weeks. A thin needle is used to sample a couple of tablespoons of amniotic fluid from around the baby. Within that fluid are cells that have washed off the baby's skin. In the laboratory, the cells from CVS or from amniocentesis are grown and looked at under a microscope so that the chromosomes can be inspected and counted. These tests very accurately tell us whether the number of chromosomes is normal or not. Both of these tests, the CVS and the amniocentesis, carry a very small risk of miscarriage. For CVS, this risk is 1 in 100, or 1%. For amniocentesis, the risk is 1 in 300, or 0.3%. In other words, CVS is 99% safe. Amniocentesis is 99.7% safe.
Screening tests are different from amniocentesis and CVS in that they don't tell for certain if there is a chromosomal abnormality. They just tell whether you have a high chance or a low chance for having a baby with an abnormal number of chromosomes. These tests usually involve a blood sample from the pregnant woman or an ultrasound or a combination of the two. These tests do not carry any risk of miscarriage. A test called early risk assessment combines ultrasound with measurement of several proteins in the mother's blood. At 11 to 13 weeks, an ultrasound is done that measures the size of the nuchal translucency, which is an area of fluid under the skin at the back of the baby's neck. Larger nuchal translucency measurements are associated with an increased chance for abnormal chromosomes, birth defects, or other kinds of genetic conditions. The mother gets her blood drawn at around the same time. The lab measures certain proteins in the blood and uses the combination of blood and ultrasound information to adjust the woman's age-related chance to have a baby with one of the common trisomies. This test will find about 90% of pregnancies where the baby has Down syndrome and more than 90% of the pregnancies where the baby has trisomy 18 or 13. Rarely the test will be incorrect and label a pregnancy as being low risk when in fact the baby does have a chromosomal abnormality. Overall, approximately 5% of women who have this test done will be found to be at increased risk. Most of these results are false positives, and in fact, these women will actually have healthy babies. Tests which come back showing an increased risk are always followed with our offering other testing to confirm the result.
Cell-free DNA testing is another type of screening test that uses a sample of the mother's blood. When we reviewed the basics of genetics, we said that our DNA is contained within our cells. When cells die, they break open, and the DNA is released into the blood, then broken into small pieces. When a woman is pregnant, within her blood will be a mixture of pieces of DNA from her own cells, as well as pieces from the placenta cells. The DNA in the placenta is nearly always the same as the DNA of the baby. Laboratories can't make pictures of the chromosomes from this DNA, but they can read the pieces of DNA and use that information to predict if the baby is likely to have extra or missing copies of certain chromosomes. This test can be done after 9 weeks of pregnancy, and there's no risk for miscarriage with this test.
This test can detect up to 99% of pregnancies affected with Down syndrome, trisomy 18, or trisomy 13. The chance for a false positive result is very low. When a result predicts a high risk, the baby usually, but does not always, have the condition. Amniocentesis or CVS is always recommended when there is a high-risk result on a cell-free DNA test. When cell-free DNA testing is performed, the laboratory can also look at the DNA from the sex chromosomes, the X and the Y, and predict whether there is an increased chance for a difference in the number of sex chromosomes for the baby. Cell-free DNA testing can detect greater than 90% of pregnancies affected with Turner syndrome. Turner syndrome is a monosomy. A baby who has Turner syndrome has only one sex chromosome instead of 2, and it is an X. Because there is no Y chromosome, babies who have Turner syndrome are always female. Most pregnancies having Turner syndrome will miscarry. Girls who are born having Turner syndrome may have correctable heart or kidney problems and may have some mild learning disabilities. They will also have infertility when they grow up.
Extra copies of sex chromosomes can also occur and may be detectable with cell-free DNA testing. Most individuals who have an extra sex chromosome will not know it and will have a normal life. Compared to their family, however, they may be taller than average and may be more likely to have speech delay and learning disabilities. One type of extra sex chromosome, men who have 2 X chromosomes and a Y, will also have infertility when they grow up. One of the companies offering cell-free DNA testing can also detect triploidy, which is an extra copy of every single chromosome, usually caused by an egg being fertilized by 2 sperm. This is a severe condition that usually causes early miscarriage.
When a woman has screening or diagnostic testing in her pregnancy, she is usually informed of the results by phone. If you have a CVS or amniocentesis, you will be told whether there is a normal number of chromosomes overall, and if not, which specific chromosome or piece of chromosome is extra or missing. If you have screening with early risk assessment or cell-free DNA testing, your report will indicate whether your chance for trisomies 21, 18, and 13 is high or low, with an actual number. For example, the report will state that your chance for trisomy 21 may be 1 in 10,000 or low, but the chance for trisomy 18 is 1 in 5, high. If the early risk assessment predicts a high chance for one of the abnormalities, you will be offered the option to have more accurate screening with the cell-free DNA testing or to have diagnostic testing, the CVS or amniocentesis, to tell for sure whether or not there is a chromosomal abnormality in your baby. When cell-free DNA testing predicts a high chance for an abnormality, CVS or amniocentesis are always discussed.
All of these tests are available through our maternal fetal medicine and prenatal genetics department at Beth Israel Deaconess Medical Center. In general, for women who are interested in having screening, early risk assessment is offered to women who will be under age 35 at delivery and do not have any increased chance for trisomy. And cell-free DNA testing is offered to women who will be over age 35 at delivery or have some other history that puts their pregnancy at higher risk. If you would like to discuss any of these tests in greater detail, or if you have any other concerns about birth defects or genetic conditions related to your family history, we would be happy to schedule a genetic counseling visit for you. We look forward to helping you decide which of these tests will work best for you.